Testing the microphone. Hello, and welcome to Planning for Health, a how-to guide for communities. My name is Wendy Ramson, and I'm the Director of Programs and Outreach for the Michigan Association of Planning. MAP is the Michigan chapter of the American Planning Association, a nonprofit membership-based organization established in 1945. We provide information, advocacy, and educational opportunities like this webinar to nearly 4,000 land use decision makers across the state. Thanks for joining us for this webinar, which will take about 30 minutes. Today, I will explore why planners and local officials should plan for community health, their role in the process, and the steps to take to incorporate health into the master plan. I'll touch briefly on implementation tools and health impact assessments and point you to further resources. I'll also highlight a technical assistance opportunity coming up in October. Let's start by defining what we mean by the term health. Most of us immediately think of physical health when we hear this word, but health is much more than that. The World Health Organization defines health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This webinar will consider all three aspects: physical, mental, and social. There are many factors that affect our health, and they are complex and interrelated. Our genes and individual behaviors play very important roles, but so does the environment around us. I had originally hoped to share a video clip from Change Lab Solutions, a nonprofit that works on innovative health laws and policies. The organization provides excellent resources, including a colorful video introducing the connections between health and our environment. Unfortunately, I had to remove the video due to technical glitches, but I think you can still get the feel of it from a few select screenshots, although I can't replicate the motion and the music that goes along with it. To build a healthy community, it all starts with our environment. We need healthy food, clean air and water, parks for recreation and play, safe transportation for people on foot or bicycle, or in cars or transit, toxin and tobacco-free places, indoors and out, affordable homes close to daily needs, communities that are safe and free from violence, where we feel a strong connection with our neighbors, jobs and opportunities to invest in our future. In other words, our health is affected by the places we live, work, and play. This theme will run throughout today's webinar. So what is our role as planners and land use decision makers in ensuring a healthy environment? At minimum, we have been tasked with protecting the public health, safety, and welfare of the community. But planners and officials also have the ability to articulate the connections between local land use and development decisions and their impacts on community health. And I'd like to make the case that planners should also be prepared to assist communities in identifying their vision for a healthy community and in developing a plan to get there. It's a responsibility that must be taken seriously because the consequences of not incorporating public health in our planning can be catastrophic and long-lasting, as we have seen with the water contamination crisis in Flint. In the early part of the last century, the urban planning and public health professions worked together to address environmental conditions that negatively impacted the health of urban dwellers. Their efforts focused on reducing infectious disease, advocating for improved housing conditions, and protecting residents from industrial air and water pollution. Later in the century, the public health and planning professions diverged in their focus, but recently the two groups have come together to work toward common goals. The American Planning Association, the APA, and the American Public Health Association, the APHA, have created the Plan for Health Partnership to build cross-sector coalitions that focus on community health. Each coalition is dedicated to meeting the needs of residents where they live, learn, work, or play by focusing on nutrition, active living, and a health in all policies approach. Plan for Health and other similar initiatives across the country recognize that land use and the built environment play a foundational role in a community's health. According to the National Research Council, the places where people live, work, and play influence many of the nation's most pressing public health determinants, such as levels of income and education and exposure to violence, as well as health outcomes, including respiratory illness, cardiovascular disease, injury, and mental health. For example, access to housing and employment affect social well-being. Sewer and water systems protect us from disease. Well-designed transportation options keep us safe. Recreation and green space support our mental health. And access to fresh fruits and vegetables support our physical health. The Center for Disease Control provides a nice visual about the links between land use and development and a variety of health concerns. For example, creating healthy destinations, such as farmers markets, can provide access to healthy and affordable food, which in turn can combat obesity. Protecting natural resources, such as aquifers and forested areas, sustains air and water quality, which in turn supports respiratory health and protection from toxins. The master plan, which primarily is concerned with land use in the built environment, can acknowledge these connections between health and the environment and facilitate changes for a healthy community in two significant ways. It can increase awareness of what a healthy community looks like by applying a health lens to the community's vision of the future. And it can modify the environment by guiding how zoning and development regulations and municipal policies support the goal of a healthy community for all. As part of the Plan for Health initiative, the APA has conducted research on the plan-making processes and health goals of master plans adopted by cities and counties across the United States. This chart reflects the top health-related topics found in these plans. The first area, active living, in plans that include this, there are categories such as active transportation, recreation, and injury prevention. Emergency preparedness has been covered in plans through climate change, emergency or disaster preparedness, and infectious disease control. In the area of environmental health, plans cover air and water quality and brownfields. For food and nutrition, plans have covered access to food and healthy food options. For social cohesion and mental health, these plans typically cover housing quality, green and open space, in some cases noise, and public safety. And finally, health, human, and human services includes access to services and aging. In other words, one role of planning is healthy community design, which can be defined as planning and designing communities that make it easier for people to live healthy lives. Next, let's explore planning processes that consciously incorporate a health perspective into the master plan. It's important to start with the basis for local government planning in Michigan. There are 2 state laws that authorize local governments to implement land use and development goals. The Michigan Planning Enabling Act, which enables local units of government to establish a planning commission and adopt a master plan for future development. And the Michigan Zoning Enabling Act, which authorizes the Planning Commission to develop and administer a zoning ordinance to implement the master plan. The Planning Enabling Act explicitly states that the master plan should guide development that promotes public health, safety, and general welfare, both now and into the future. The Act includes a list of elements that a master plan should incorporate to protect the public health, safety, and welfare of the community. These elements are a transportation system for safe and efficient movement, safety from fire, light and air, healthful distribution of population, good civic design, sewage disposal and water supply, and recreation. So what does a master plan that supports a healthy community look like? Sometimes this approach is referred to as health in all policies, which gives us a health lens to look at land use and the built environment differently. Next, we're going to explore ways to incorporate health into the master plan. ChangeLab Solutions outlines a variation of the traditional master planning process with an added emphasis on collaboration with local health professionals and engaging the community broadly on the issues of health. The steps that they recommend are convene and collaborate, engage and envision, make a plan, invest in change, and then track progress. While most of your communities likely already have a master plan, this process can also be adapted to a master plan update. The Michigan Planning Enabling Act requires that communities review their master plans at least every 5 years and update them if necessary. So let's start the master planning process by laying the groundwork for the plan with the convene and collaborate step. A good place to begin is to identify and reach out to potential partners. Ask yourself what individuals and groups have a role in your community's health and who has specific knowledge about health issues. Planners and health practitioners see the links between health and the built environment from different points of view. Health practitioners approach the issue through health promotion and disease and injury prevention, while planners may begin with features of the built environment, such as transportation systems, neighborhood density, and mix of uses. Both perspectives can yield valuable insights, and as a result, should be incorporated from the very beginning of the process. Here is a partial list of the types of partners and stakeholders you might want to seek out. Connecting with your county public health department should probably be your first step. Communities that have worked on walkability and safe routes to school initiatives have found their public health officials to be enthusiastic partners. Also, consider Parks and Rec staff, since they're in the business of active living, and faith-based organizations, many of which provide services such as meals and rides to medical appointments for their members. Schools are another good resource, since they typically have health professionals with a unique insight into the health issues of local families. Social service agencies will have an understanding of the health challenges of special populations, such as seniors and veterans. Most of us are aware of how our individual behaviors affect our health, but it's not as obvious how land use and built environment may affect us. For instance, how the lack of non-motorized facilities links to obesity, or how zoning restrictions may present obstacles to urban farmers selling fresh produce. An important step at the beginning of your master plan process is to raise awareness of these connections. Some ideas of ways to do this include walking audits to highlight unsafe pedestrian and bicycle facilities, farm tours to illustrate the pressures of converting agricultural land to new development or the challenges in getting farm products to our tables, or perhaps a lecture series by local experts on topics such as barriers to aging in place or protection of the drinking water supply. After identifying the stakeholders, it's important to develop a community engagement plan. Most communities working to incorporate health in their plans form a coalition at the very beginning. The Michigan Department of Health and Human Services is currently supporting a diverse group of counties working on the Michigan Health and Wellness 4x4 initiative. This initiative aims to reduce obesity through 4 key healthy behaviors: maintain a healthy diet, engage in regular exercise, get an annual physical exam, and avoid tobacco use and exposure. Be Healthy Berrien is a 4x4 county. It's a coalition made up of the county health department, the local United Way, 2 YMCAs, and the Southwest Michigan Planning Commission. Healthy Pontiac We Can is a different type of coalition, but it's made up of local hospitals, mental health agencies, human service agencies, schools, churches, government agencies, and the Pontiac community. Other techniques for engaging the community are conducting a survey about community health-related issues or forming committees to explore specific health-related topics, such as local food systems or safe routes to school. Open houses are a useful technique, especially if you hold them in health or recreation locations. Once you've started pulling everyone together, it's important to provide a sound, evidence-based understanding about the health issues in your community. Think of this effort as a community checkup. First, you collect demographic and health data. A good place to start is your county health department's Comprehensive Health Assessment, CHA, and Comprehensive Health Improvement Plan, CHIP or CHIP. Other sources of data include regional planning agencies, the U.S. Census Bureau, the USDA Agricultural Census, and local school district data. Based on your initial data collection, analyze the community's demographics. Can you determine if your community has vulnerable populations like low-income seniors or a high incidence of things like asthma or obesity? Check with your regional transportation planning agency or municipal engineering department to collect transportation safety information. For instance, what are your pedestrian and bicycle crash rates? If you have done a Safe Routes to School audit, what were the findings? Then, in preparation for the next phase of the planning process, scan your current planning documents, such as your master plan, your recreation plan, your CIP, etc., for references or linkages to health issues. Once you've reviewed the data, develop a list of health issues that could be addressed in your master plan. Think about the health trends that will impact the community. Perhaps it's the growth in the over 80 population or increases in predicted bicycle crashes. This process will net a lot of interesting data, but not all of the issues you identify will have an evidence-based link to the built environment. However, there will be a surprising number that do. The City of Holland's new master plan provides an excellent example of this data assessment. The city explored county health trends as part of the planning process. Holland is split between Ottawa and Allegan counties, so they looked at the community health assessment for each. The community health assessment for Allegan County identified the need to improve the number of healthcare providers, transportation access to healthcare, and the cultural practices of residents. Ottawa County's key health issues were high rates of obesity in adults, poor vegetable and fruit consumption in the population overall, and excessive alcohol use. At first glance, the excessive alcohol use issue seems least connected to potential planning solutions, but a case might be made for tackling it through zoning restrictions on the location of retail stores selling alcohol, such as spacing requirements from schools. More research would be needed to determine if the change would likely impact the behavior. To finish out your data gathering process, go back and update your community engagement plan based on what you learned. Do you need to invite missing stakeholders? Are there local experts that can contribute knowledge, or groups that might be able to provide grant funding to implement the recommendations of the plan? With a multidisciplinary team and data at the ready, it's time for you to start developing a vision for health in your community and incorporating it into your master plan. The APA Plan for Health study I mentioned earlier identified those 6 community health issues that are common to many master plans. Think about which of these might be a needed addition to your community's master plan. I'll give a little further definition of each. Active living is integrating physical activity into daily routines. Emergency preparedness means a readiness to protect public health when disaster strikes. Environmental health is a safe and healthful environment for people. Food and nutrition means a food system designed to facilitate healthy eating. Health, human, and public services means equal access to care and preventative services for all. And then finally, social cohesion and mental health means a built environment that supports access to social, economic, and mental health benefits. Before you start writing your plan, decide how to incorporate your health goals and actions. Health elements can be standalone or separate chapters in your plan, or the focus on health issues can be woven throughout the plan in a health in all policies approach. Looking back at the City of Holland's master plan, they took a hybrid approach. There is a standalone chapter on social services and community health, but health considerations are also included throughout the plan. Next, looking at your existing master plan recommendations and policies, re-examine the traditional planning topics through a health lens. Do your zoning restrictions allow a mix of uses? For instance, residential uses in commercial areas. Allowing a mix of uses increases the opportunities for people to walk or bike between home and stores, office and nearby recreation, etc. A mix of housing types can support housing affordability, and with it, social well-being. Development regulations can be revised to shape the features of new neighborhoods by, for instance, requiring playground equipment in common open space, or sidewalks or trails to connect to schools and adjacent neighborhoods, or providing street trees to give shade and reduce flooding. Your capital improvements priorities likely already address public health and safety and infrastructure, but could they be expanded to increase things like aquifer protection or traffic calming installations? Before moving to recommended actions, it's important for the community to identify and reach agreement on its values and a future vision. This should be a robust and inclusive community discussion that leads into the development of goals and objectives for the plan. This could require a whole separate webinar about how to do that, but suffice it to say that this is a very important element of your master plan process. So for an example of goals and objectives, or goals at least, the Green Grand Rapids Plan includes several goals under the category of healthy lifestyles and healthy environments. They are: improve access to local food sources, increase and maintain human health and wellness, increase availability of recreational programs and facilities. These goals, in turn, guided specific recommendations in the Green Grand Rapids Plan. One part of the goal-setting process that is often forgotten is the selection of metrics for use in evaluating the plan's effectiveness moving forward. The American Planning Association just released a new report titled Metrics for Planning Healthy Communities, which identifies a set of healthy planning metrics that can be used to assess, measure, monitor, and report progress toward healthy planning goals. We will post a link to this report on MAP's Planning for Health website. Perhaps the hardest but most creative part of the planning process is developing recommended actions that will implement your health goals and objectives. Here are some examples for consideration. In the area of active living, consider revising your residential zone use restrictions to allow small grocery stores, maybe as a special land use. The idea here being that providing convenience goods in neighborhoods will encourage people to walk or bike rather than drive to have their daily needs met. In the area of emergency preparedness, identify cooling station locations near vulnerable populations for heat emergencies. Now, it's quite possible that your community's hazard mitigation plan has already done that, and maybe as a part of your process, you understand or identify where those connections may be between the master plan and the hazard mitigation plan to pull those two together. In the area of environmental health, you could adopt a brownfield redevelopment project review process. If you already have a brownfield process, maybe you assess whether the projects to date have been successful in eliminating soil or water contamination, and if they haven't been, how the process could be improved. In the area of food and nutrition, you could revise use restrictions to allow seasonal farm stands in shopping center or apartment complex parking lots. Many communities restrict temporary outdoor sales to goods and services provided on site, for instance, a sidewalk sale, but having the ability to get fresh fruits and vegetables where you are shopping already or where you are living could be a great advantage. In the area of health, human, and public services, you could consider revising the zoning ordinance to allow emergency warming shelters in churches for homeless individuals during the winter. Many churches are approved by special land use and have pretty narrow limits on what would be allowed, although these restrictions may not anticipate mission-driven activities like a warming shelter. And so that's something to consider adding to your code. For social cohesion and mental health, perhaps you support your aging in place goals by revising the zoning ordinance to allow for accessory dwelling units by right. Your master plan will provide a foundation for a healthier community. But to use all this good thinking as a springboard for action, it's important to think about approaches you can take to implement the plan's recommendations. These typical planning and regulatory tools can be used to implement health-related recommendations. For instance, in zoning regulations, I had mentioned mixing land uses, but you could also consider revising your setback requirements, perhaps to make front setback requirements reduced to bring more activities closer to the street and support a walkable, bikeable environment. Zoning restrictions can also be used to protect properties from damage and people from being injured or killed through floodplain regulations. This can reduce building that's put in hazardous areas. You could look at your adopted policies. Hopefully you already have a complete streets policy, but perhaps you update that. You could also look at your recreation plan and determine, are there parkland minimums that you should abide by as new residents are added to the community. As I mentioned before, your brownfield redevelopment policies should be examined. In the area of capital improvements programming and budgeting, Perhaps you should have a sidewalk gap program added. This could, over time, reduce the areas where it's difficult or unsafe for pedestrians to access. Also, a capital improvements plan can address street lighting for improvement for pedestrian access and comfort, and also as a crime deterrent. For development review standards, street tree requirements, maybe pedestrian connections, bicycle parking requirements at stores and offices to encourage people to commute by bike or walking, and perhaps incorporating crime prevention through environmental design as a part of the site plan review process. Although technically more of a pre-implementation tool, health impact assessments provide a new approach for assessing the alignment of a public or private project with your community's health goals. This interdisciplinary process pulls together scientific data, health expertise, and public input to determine the potential health effects of a proposed action, such as a policy or project, before you make a final decision. HIAs can offer practical recommendations for ways to minimize risks and capitalize on opportunities to improve a community's health. Think of this analysis as similar to an environmental impact assessment, but specifically for human health. The American Planning Association has created a toolkit to offer planners background and advice about navigating the HIA process, which is often led by public health professionals. They identify 6 steps in the process, including screening, scoping, assessment, development of recommendations, reporting, and monitoring and evaluation. The toolkit provides tips for conducting HIAs along with links to a variety of examples from around the country. This table is from an HIA for a transit-oriented development project. It may be a little difficult to read, but it is reporting on 12 different health determinants, including active transport, safety from crime, food access, green space, and gentrification and displacement. Within Michigan, several communities have undertaken HIA assessments in the past. They include Ingham County, which conducted an evaluation of the City of East Lansing's non-motorized transportation plan, Grand Rapids, which conducted an HIA for its Michigan Street corridor planning effort, and the City of Ann Arbor used the tool as part of its urban forest management plan to assess health outcomes associated with targeted tree planting in low canopy areas where the population was more vulnerable to extreme heat events. MAP has created a web page with a curated group of resources, such as toolkits and guides mentioned today, that will be helpful to planners and officials interested in pursuing health initiatives in their communities. A recording of this webinar will be placed on the page, in addition to links to the examples from several Michigan communities that I've mentioned that have succeeded in incorporating health into their master plans. Also, on the resource page, we will be posting details for an upcoming technical assistance opportunity to become available in October 2017. Technical assistance for incorporating health into master plans will be available for communities located within the Department of Health and Human Services 4x4 counties. Please feel free to contact MAP for more information about this opportunity, or if you have questions from today's webinar. In closing, I would like to recognize the support of the Michigan Department of Health and Human Services in providing this Planning for Health training. For more information about MAP and the training we offer, please contact us at info@planningmi.org. Thank you very much for joining us today in this webinar.